Health experts are sounding the alarm after another child in West Texas died from measles. As of April 4th, 481 cases have been confirmed. Joining me now to talk about ways to protect yourself and limit the spread of measles, Dr. Carla Garcia Carreno, Children's Medical Center Plano Director for Infection Prevention and Control. Thanks so much for joining us, Dr. Carreno.
Thank you for having me.
Let's talk about the measles and how to know if you have or need 2 doses of that MMR vaccine.
In general, 2 doses are recommended, but if you're an adult that got 1 dose, there is 93% chance that you're protected. If there is high-risk situations, if you're a healthcare worker or need to travel internationally, or in case of outbreaks or in higher institution, higher education institution, 2 doses are recommended. If you're not sure how many doses you got, talk to your primary care physician. There can always be a blood test that can be sent to make sure that you are protected against the measles.
Now, there are a lot of questions when it comes to the youngest among us, right? Can you talk a little bit about the vaccine schedule, particularly for babies as they grow?
Yeah, as you well said, the first dose is given to babies 12 to 15 months of age, and that confers 93% protection to the population. And then the second dose in the United States is recommended before school entry by age 4 to 6 years of age, and that confers 97% protection to the population. So it's a pretty good protection and it's lifelong. Now, in cases of outbreak or before international travel, there is a recommendation to give the vaccine to babies as young as 6 months of age. So between 6 to 11, they can still get a dose of the vaccine. However, that wouldn't count to the regular immunization schedule. They will need 2 additional doses.
Dr. Carreno, can I still get the measles if I'm vaccinated?
The chances are very low, but remember, after 2 doses, there is a 97% protection, so there is a 3% of the population that has received 2 doses that can still get it. However, the chances are minimal, and if a vaccinated person does catch the measles, the course is going to be way less severe.
So what do you do if you've been exposed or you've been someplace where an infectious person has recently been?
Yeah, if you're unimmunized, you have the risk to catch the measles. This is one of the most contagious, if not the most contagious, infectious disease there is. So it's really important that you communicate with your primary care physician immediately, because within 72 hours of exposure, you can still get the vaccine that will still confer some protection. Between day 3 and 6 post-exposure, there is indication for immunoglobulin that can be given as a shot in the unimmunized person. Now, if the exposed person has received the vaccine, there is no intervention that needs to be done. There is no isolation or quarantine required, just to monitor for symptoms.
Dr. Carreno, I know I've talked to you before. Other reporters here at the station have talked to you about measles, right? And the risk of the spread of the virus. What is your message for people who say it's just measles, it's not that big of a deal?
Yeah, even though it may not get complicated, you can have complications from the measles. About 20% of people with measles may require hospitalization, most likely secondary to respiratory or neurologic problems. About 5% will complicate with pneumonia. 8% can have diarrhea and dehydration requiring hospitalization, and 1 in 1,000 can have encephalitis or brain inflammation or swelling. 1 in 3 to 1,000 can have a fatal course. And even if you don't have any complications acutely or in the short term, there are long-term consequences, like you can have a blunted immune system response to other pathogens, and you can have a brain inflammation that is fatal and can occur years, 7 to 10 years after the acute infection. So it's not just a viral illness.
Dr. Carreno with Children's Health in Plano, we want to say thank you for taking the time.
Thank you, Dia, for having me.